If you have health insurance in America, there's a pretty good chance that you're getting ripped off. No, and I don't mean by rising premiums. I don't mean by massive deductibles. No, there is another way that you're also getting ripped off among the myriad of other ways. Copays. And it turns out copays often, or at least sometimes, I know that's a bit of a contradiction. I'll explain that. Actually cost more than the medications themselves. Now, I'm going to go to PBS NewsHour. We actually did a great story about this. And they talked about a couple that ended up paying more for a copay for a medication that was actually more than the drug was worth. Now, this couple, Gretchen Liu and Xingming Ma. Now, Xingming Ma is, of course, a former or a retired physicist. So it's not like they couldn't afford their medication, but nonetheless, they had some issues with expensive copays. Now, let me give you some context here. 2 years ago, Liu, 78 years old, had a transient ischemic attack, which experts sometimes call a mini stroke, while on a trip to China. After she recovered and returned home to San Francisco, her doctor prescribed a generic medication called telmisartan to help manage her blood pressure. Now, Liu and her husband are insured through an Anthem Medicare plan. So that's one of their Medicare supplemental plans, right? Now, the supplemental plan is, of course, through private insurance. Now, Ma ordered the telmisartan through Express Scripts, the company that manages pharmacy benefits for Anthem and also provides a mail order service. Now, how much is the copay for that 90-day supply? $285. That's expensive, man. And in fact, this is supposed to be a generic medicine. So when Ma pointed that out, he's like, wait a minute. He said, quote, I couldn't understand it. It's a generic. But it was a serious situation, so I just got it. Which I think is something that a lot of people would be like, yeah, it's a serious situation. This medication, oof, well, you know, this is expensive, but I don't have a choice. They kind of got us over a barrel. And that's unfortunately indicative of our entire healthcare system. They got you over a barrel. What are you going to do? Not take it? For a lot of people, that's not an option. And of course, unfortunately for a lot of people, they're not able to afford it, so they don't take it, and guess what happens? They die. But anyway, a month later, Ma and his wife were about to leave on another trip, and Ma needed to stock up on her medication. Because 90 days hadn't yet passed, Anthem decided they would not cover it. So during a trip to the local Costco, Ma asked the pharmacist how much it would cost if he got the prescription there and paid it out of pocket. Now that's where the story gets interesting. Turns out that the pharmacist told him that it would cost a total of, drumroll please, $40. Wait a minute. So the prescription using insurance was $285, but just to pay for it out of pocket was a total of $40. It's cheaper without insurance. Weird. Now, Ma said, I was very shocked. I had no idea if I asked to pay cash, they'd give me a different price. Now, I think a lot of people didn't have that, didn't know that that was a possibility. But it turns out it actually happens fairly often. In fact, according to a study published in March by the University of Southern California Schaefer Center for Health Policy and Economics, insurance copays are higher than the cost of drugs about 25% of the time. So that is a quarter of the time the drug is actually cheaper than the copay. USC researchers analyzed 9.5 million prescriptions filled during the first half of 2013. They compared the copay amount to what the pharmacy was reimbursed for the medication and found that in cases where the copay was higher, the overpayments averaged a total of $7.69, which totals to about $135 million that year. Now, USC economist Karen Van Nuys, a lead author of the study, had her own story of overpayment. She discovered she could buy a one-year supply of her generic heart medication for $35 out of pocket instead of $120 using her health insurance. Van Nuys said of her experience, and media reports that she read about the practice spurred her and her colleagues to conduct the study. She also heard industry lobbyists refer to the practice as an outlier. Oh, it's an outlier. It hardly ever happens. In response to that, Van Nuys said, quote, "I wouldn't call 1 in 4 an outlier practice." 1 in 4, 25% of the time. So you could be overpaying your insurance because of your copay for your medication and not even know it a quarter of the time. What a scam. Now, Jeffrey Joyce, a USC economist who co-authored the study with Van Nuys, says, quote, "You have insurance because your belief is, and this is what makes it so insidious, you're paying the premium, so when you need care, a large fraction of that cost is going to be borne by your insurance company." Which turns out that's not the case. Even with the ACA reforms, you still end up paying money for a lot of your money for things like advertising to your insurance company. Money that does not go to your care. And in fact, he continues, the whole notion that you're paying more for the drug with insurance is just mind-boggling. To think that they're doing this and getting away with it. Well, that's unfortunately our system in a nutshell. In fact, Joyce told PBS NewsHour Weekend that inflated copays could be explained by the role of the pharmaceutical supply chain played by pharmacy benefit managers, or PBMs. So now let's get into the details of why this can happen and who benefits from it. He explained that insurers outsource the management of prescription drug benefits to pharmacy benefit managers, which determine what drugs will be covered by a health insurance plan and what the copay will be. Joyce said, quote, simply, PBMs run the show. So that's your problem here, right? So you have an insurance company that basically outsources who determines what they actually cover. That doesn't make any sense. Now, in the case of Express Scripts, the company manages pharmacy benefits for insurers and also provides a prescription mail delivery service. So they put that little extra cherry on top, at least. But basically, they control what Anthem covers, what pharmacy benefits you actually have, and what tier your drug is going to be in. And of course, the tiering is what determines the price. So if your drug, for example, is on tier 1, it's incredibly expensive. If it's tier 5, then it's not expensive, and it doesn't matter if it's a generic or not. It all has to do with these PBMs. Now, Express Scripts spokesperson Brian Henry confirmed to PBS NewsHour Weekend the $285 copay that Ma paid in 2016 for his wife's telmesartan was correct, but didn't provide an explanation as to why it was so much higher than the $40 Costco price. They can't explain it because there is no explanation. Somebody just wanted to make money. That's what it is. Now, Joyce did say on that it's possible another set of behind-the-scenes negotiations between the pharmacy benefit managers and drug makers played a role. He explained that drug manufacturers will make payments to pharmacy benefit managers called rebates. Rebates. Now, what are rebates? Well, apparently they help determine where a drug will be placed on the health plan's formulary. Formularies often have tiers, which is what I was explaining earlier, that determine what the copay will be, with the tier 1 drug often being the cheapest, so I kind of had that mixed around, and the higher tiers being more expensive. Pharmacy benefit managers, however, and this is where the grift comes in, usually take a cut of the rebate and then pass them on to the insurer. Insurers say they use the money to lower costs for patients. Sure. Oh, no, sure they do. So the drug manufacturer hands a bunch of money to the benefit managers. The benefit managers take some of that money and they give it to the insurer, who promises to make drugs a little bit cheaper for the patient. Now, I don't know if you guys who are watching are on medications, but does that seem cheap to you? Are your medications cheap? Odds are probably not, especially since in Canada, drugs are cheaper. In Europe, drugs are cheaper. In fact, it seems like the drugs here are more expensive than everywhere else. That's weird. So here's the thing. So these PBMs, right? These guys are a middleman. They just take a cut from the rebate. Now, Joy said the rebate to a big rebate to a pharmacy benefit manager can mean placement on a lower tier with a low copayment, which drives more patients to take that drug. So it's not about choice. It's not about capitalism, right? It's about how much did the drug maker, so say they come up with a new drug and they want more people to use it. It might not be completely tested and it might not be completely safe. But they really want to sell this drug. So they go, hey, here's what we're going to do. We're going to give you a rebate. Put us on a lower tier so that more people will use it. Now, the problem with that is that actually there's a lot of different problems with that. I think just one of them is, again, what if you're not prescribed that medication? You're prescribed something different that ends up in a higher tier. You're out of luck. You're going to pay even more for that medication. You're going to pay $285 for a 90-day supply. You're going to pay $1,000 for insulin. You're going to pay an outrageous amount because, sorry, we bribed the PBMs to put you on a lower tier. That's what this is, man. That's a scam. Not only that, but Joyce says, quote, it's financially in their benefit that you take the other drug, but that's of little consolation to the person who just goes to the pharmacy for the prescription that their physician gave them. Joyce also said the pharmacy benefit managers also profit when collecting copays that are higher than the cost of the drug. So now they're incentivized to collect higher copays. Ridiculous, man. Look, this is a scam, and it's exactly why a profit motive should not be involved in medicine. And if you're wondering why your insurance is so high and your copays are high, it's because somebody is making money off you. In fact, you have people whose only role is to profit off higher copays. That's it. And look, when a pharmacist collects a copay at the cash register that's higher than the cost of the drugs, and the pharmacy benefit manager takes most of the difference, they actually have a name for that. It's called a clawback. This is so pervasive and so widespread that they've literally named it. And in fact, there's been a lot of companies that have been getting into a lot of trouble for doing this, despite the fact that it's 100% legal. In fact, let me go here to the defense here. I'm not defending, but here's their defense, right? The three largest pharmacy benefit managers, Express Scripts, CVS Caremark, and Optum Prescription, or Optum RX, all told PBS NewsHour Weekend that they do not engage in clawbacks. However, that's not true. That's not true. They're saying, oh, clawbacks? No, we don't do that at all. What are you talking about? Howard Jacobson, however, who's a pharmacist at Rockville Center Pharmacy in Long Island, New York, had specifically showed PBS NewsHour Weekend several examples of clawbacks. In one instance, Jacobson acquired a dose of the generic diabetes metformin for $1.61. So that's how much it cost, right? He said if a patient paid out of pocket, he would sell it for about $4. But in a recent transaction, the pharmacy benefit manager told Jacobson to collect a $10.84 copay from the patient and took back $891 in a clawback. So they get the medication for $1.61. They charge $4. Okay, so they're making a little bit of money, right? Now, the benefit manager wants a lot of money and says, you know what? We want you to collect a $10 copay from the patient, and I'm going to go and I'm going to pocket the rest of that money. That's a scam. And every day in America, regular people are getting scammed like this. 1 in 4, 25% of all these medications, these transactions, actually cost less than the copay because of this. Look, man, here, let me give you one last quote here from Mr. Ma there. He says, quote, "You have no choice. You can't bargain. I knew I wasn't going to win." And in the current system, he's absolutely right. There is no way that you can win against this because you're dealing with this. You're playing on their terms. They set up this field. They rigged the system in their benefit in order to make money from you, to take as much money, to get as much money from their shareholders as they can. This is why we need Medicare for All. We got to eliminate the insurance companies. That would get rid of the problem really quick. How about you let, instead of these intermediaries, which pocket some of that money, why don't we have Medicare directly negotiate with the drug manufacturers? That would make sense. And guess what? Americans would save trillions of dollars. And people would actually get the medications that they need without copays, without padding somebody's pocket. Wouldn't that be amazing? Because right now, the current system that we have is rigged against you. When you pay more in copays than the drug is worth, which happens a quarter of the time, somebody pockets that difference. They put it in their pockets for no other reason except for the fact that they can, and they can get away with it. It's time to get a new system. A new system that serves people and not corporations. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.